Our patient today is a 48 years old male who had a previous procedure and fortunately did not get the greatest results. So he is here today to get another procedure. And I'll walk you through what I do to design the hairline. This equipment is called TricoLAB. TricoLAB can take images in the 3D by moving this camera circumferentially and then combining it as a one image here. For example, you see it's very easy for me to rotate it and visualize the hairline, show it to the prospective patient, and also to confirm how many grafts do we need, how many grafts do we have in donor area, because this TricoLAB platform not only taking 3D images, but also utilizing a high precision microscopy camera to take samples over different areas, so we know what's the density in the recipient area, what we have available in the occipital area or the donor area. In order for us to say, oh, this hairline looks natural, it has to follow certain rules. So here's somewhere is our lateral canthus. It has to correlate with this frontal angle. So our hairline is supposed to be a round shape, both frontal angle. For men, they needs to be pretty noticeable. Everyone like to see their hairline being perfectly symmetrical, but anything symmetrical is not natural. So I always want to make sure there's some pre-programmed level of asymmetry. All right, so as you can see, we have new transition zone. That's where all the irregularity will be happening. Then we have our high density zone, or this actually what will define our hairline and frame the face. Another areas of concern for our patient is the crown area, and you can see here our mid scalp in this case looks pretty normal. I don't think we need to do anything surgical in this area right here. It's a mid scalp. Then let's take a look here. This is our recipient area zone. So based on how many square centimeters, if we just do frontal zone, we need approximately 3,640 grafts. And this is counting 15 grafts per centimeter square. Now the final step to actually visualize our result. Here's the patient, the projected results. So you can see based on this 3,640 grafts, which is suggested, this is the projected result. Okay, so let's see what's happening actually during the surgery.
Good morning, everyone. Dr. Max here. Our patient today is 46 years old male with Norwood 3 to 4 with some filling in the crown area. Patient had a previous FUT procedure which did not go very well. His retaining density is pretty low, so he is here today to get another procedure using an FUE method to restore the anterior part of the hair. We are planning today exactly 2,000 grafts. Maybe we'll get 2,050 or something like this. Now I finished harvesting from the temporal part here, and we are finishing last stage of collecting this graft, and then I will work on the occipital part. As you can see in the back, there is a high power microscope. It's wall mounted. It allows me to work very ergonomically and efficiently. In addition, I use this exoskeleton that supports my arms in a certain position, so I don't have to frequently readjust myself. As you can see, it's a microsurgery essentially. And with the microsurgery, you have to be very precise down to fraction of the millimeter with the angle and positioning the punch around the hair shaft. In my case, when I use this high power equipment versus regular loops, I pretty much minimize it to less than 1% the transaction rate. So what that means, if I try to harvest 2,000 grafts, I will punch maybe 2,010 times and harvest 2,000 grafts. A lot of these cheap clinic, technicians will use very cheap Amazon style glasses that not even give any type of high definition view, and inadvertently they destroy a lot of the donor area, which is irreplaceable. So please make sure that you do your research before you decide what clinic to go to. Your best bet is always make sure it's led by a physician, and physician does the entire procedure from the beginning until the end. I estimate we have another hour to finish the harvesting of the hair follicle, and we'll continue with implantation using the same approach. Stay tuned, we'll get you updated as we go. Hey guys, now it's 4 p.m. We just finished implantation. It was 2,200 grafts planted to the frontal area, just like we planned in the beginning. Patient had a previous procedure elsewhere with not so good results. We just finished. Everything was placed as always using this high power microscope. No complications. Patient was very comfortable because anesthesia was administered. As soon as we're done with implantation, he went straight into the hyperbaric oxygen therapy. Now we'll get a 2.5 ATA, which is equivalent of 60 feet underwater, and he's going to be breathing pure oxygen. What it does, it helps to rescue these grafts, because grafts were sitting outside the body for a very long time, for 4 or 5 hours, and they're pretty much struggling because there's no blood flow, so oxygen was not delivered. So now we can give 800% more oxygen delivered to every single graft. It also helps to reduce the inflammation. It helps to stimulate a new blood vessel creation into the graft tissue. It pretty much ensures that every single graft survives after the transplant. You don't need to have a 4,000 or 5,000 grafts that they're trying to sell you in those cheap clinics. As long as you make sure that every single graft survives, you can have the same result with less grafts and more grafts left in your donor area. Stay tuned at Herbert Dr. Max Restoration Center.